In our makeshift medical facility, behind me in the distance, we have Candace, Lori Lee, and Rayanne with other individuals from the village that we're staying in which they are giving vaccinations, pills, and just basic checkups such as just heart rate and breathing, just kind of make the individuals feel like they have been checked. And that's all based on the medical supplies and, of course, the funding that we have here with Hope for Kids. Behind me, we have Josh and Matt, who are both handing out gifts, glasses that have been given to Hope for Kids to help out the individuals read and work with tools or such with their hands a lot easier. We've been working with individuals from children to the elderly, and we've given out roughly, probably close to somewhere around 200 glasses at this point. Rayanne, if you could tell us a little about what goes on here.
We're in the village of Maruba, seeing people who don't have access to regular medical care by going to the clinic. They don't have transportation, so we've come to the local village and we've set up a clinic in a goat shed, I think. I'm not exactly sure what it is. But what we're doing is providing medication, diagnosis, and treatment for the local people. We've brought a doctor whose specialty is eye care ophthalmology, and then the nurses were diagnosing and treating malaria, meningitis, actually anything that's come up that we can treat. We're providing medications. We're doing eye exams for reading glasses, and we're just doing anything we can, referring to hospitals for those things that are beyond our scope of practice here.
What has been kind of the most prominent issue today so far?
So far, we're seeing a lot of malaria. This is just after the rainy season, and they're in an epidemic period of malaria, so we're treating an awful lot of malaria. Secondary to that are intestinal worms. We're treating everybody here currently for intestinal worms. It's a serious problem.
How does funding affect this for maybe future field work?
Funding is an essential part of the program here. We come in country and we purchase medications here. Without those medications, we obviously couldn't do any treatment. As many of you probably know, we fund our own way over here. We pay to come here to work and to serve, which is our pleasure. But in terms of being able to buy medications, to have the syringes to give the injections with, that is money that is essential. The funding for that is essential. And I don't think that I understood when I got here, these people, they don't have pens, they don't have soap, they don't have paper to write on. So even those little things, we are improvising today. We did not have containers in which to put our syringes. So we've all had to drink a lot of water, so we have containers to put our dirty needles into. This is just something sort of we've had to be very creative and think outside the box in order to function. So funding is an essential part of this mission work.
I think one of the most powerful words I think we've been able to use today is simple words of God bless.
Absolutely.
From a fishing village in a small part of Uganda, Rayanne, thank you very much.
My pleasure.
I'm here with Isaac Okanda of a small fishing village. What's the name of your village again, Isaac?
It's Maruba Beach.
Maruba Beach.
Yes.
How many people live in Maruba Beach area?
About 2,000.
2,000 people.
In this location.
How many people have visited our clinic today, do you think?
There are more than 200.
What do most people do for a living here in the village?
Most of the people who are living here, they are fishermen. And also we have those who are digging around. There are farms also that they are working for.
Excellent. And do you have a family yourself here?
Yes, I have a family here.
How many children do you have?
I have 4 of them.
Isaac, the more time I spend here in Maruba Beach, the more I'm starting to understand some of the ins and outs of Uganda and some of the smaller villages. But I think village to village varies on some of the diseases that affect the people of Uganda. Could you maybe tell us about some of those diseases?
Yes, some of the diseases that are affecting very much people in this area. It is dysentery, and we don't have this clean water. We use the lake water, and so most of the people have diarrhea all the time when they use. Some bleed. So those are types of the disease we are very much being affected from this area. And also we have people who are being affected because of the hospital being very far. We have a hospital distance of 3 kilometers from here, of which we are getting it so rough, at least when we want to be treated.
Isaac, thanks a lot. Again, from Maruba Beach, my friend Isaac.
Hallelujah.
And Kelly Kiki. Thank you.
Sleep tonight, and may your dreams be